So welcome to the Scaleup Valley podcast, where we bring the best of the best to help you scale your business from 1 million to 1 trillion. Today's guest is G, the co-founder and CEO at Paloma Health. G, welcome to the show.
Thank you, Mike, for having me. It's great to be here.
It's a pleasure, and I'm sure that people will understand very, very soon why I've invited you and Paloma Health. But before going to the story, let's get to know more about you and Paloma Health.
Cool. Yeah, happy to share more about my background. I'm French. I actually started my career in London, not in France, as an investment banker. And I decided that, I should try to follow another career path. So I decided to move back to France to start a business. And I got pretty lucky. I got involved in 2 startups. They both got acquired and decided to move to the United States after that with my wife, who's half French, half American. That was 7 years ago. And I became a general partner at Interplay Ventures. So Interplay Ventures is this amazing venture fund / foundry / incubator in New York City, where I was able to really create my network in the United States, learn a ton, and really when one of my best friends was diagnosed with hypothyroidism 2 years ago, I felt compelled to go back to building and being an entrepreneur again. And so decided to quit my job at Interplay to start Paloma Health. And we've been, building Paloma Health and improving hypothyroid care in the United States since then.
Sounds amazing, and great track record, great experiences scaling up companies. But tell us a little bit more about where you are in terms of the growth of Paloma Health and a bit more of the story of Paloma Health.
Yeah. So we're actually at a key moment for the company right now, because for the past 2 years, we've been direct consumer only. And that has been working great. But recently, over the past 3 or 4 months, a lot of new B2B partners, can ask us questions. And now we're working with a bunch of those. So Paloma Health is both a direct consumer and a B2B company, helping, close to 20,000 patients now with hypothyroidism. And really, I think we've scaled it, progressively, from first building the key components that were, I think, answering the main pain points for hypothyroid patients. And those were really around testing and finding a good doctor. And over the past 2 years, we've really tweaked and improved our product to add new blocks and new features to our product so that patients with hypothyroidism can get everything they need when it comes to their thyroid care through Paloma Health. And so now in terms of product, it took us 2 years to get to where we are today, but we're in a very good place, we think, with the app and the web app and all the features that we've built. And so we're very excited that, it comes exactly at the right time, because now we're also scaling and expanding on the B2B side. So that's kind of where we are right now. We're live in 35 states. As you can imagine, that was hard, right? Because every state is a country, where each doctor needs to get new licenses, or you need to find a new doctor. We also partnered with some pretty big health insurance companies, so Aetna, United Healthcare, Blue Cross Blue Shield, and Cigna. And same thing there. You have to get those contracts. It's on a state-by-state basis. And so that also took a lot of time. So honestly, slowly but surely, that's the thing about healthcare. It's slow. Even if you try to move as fast as any other startup, it's still slow, but slowly you're building the moat. And that's, that feels good. And I feel like with, 17 providers now in the team, 35 states, some key relationship with drug manufacturers, patients advocates, we started to build a moat for this patient population of hypothyroid patients.
Got it. For the ones who are listening and are asking themselves what the hell is hypothyroidism, this is something that I am also suffering. I was diagnosed last year. I've shared on social media for the ones who follow me. But for the ones who have never been in touch with this autoimmune disease, what is that about?
So the thyroid is also sometimes referred to as the master gland because it regulates every single organ in our body. It's at the base of our neck here, and it produces hormones, and those hormones are key. It's kind of like, to make a silly comparison, it's when your phone has a dying battery and every single app is going to turn very slowly. That's the same thing with hypothyroidism, you know. Every single organ is not getting the energy it needs to work properly. And so the patients with hypothyroidism, unfortunately, will have, for the rest of their life, they will have to take this medication called levothyroxine. But there are multiple options there. I don't think we need to go into too much detail. Yeah. What's interesting is that levothyroxine is the most prescribed drug in the world, and it's number one or number two most prescribed drug in the United States. And I think that's something that people really don't know, is how common hypothyroidism is, and unfortunately how underserved it is as well. And so that's exactly what we're trying to do at Paloma Health: improve access to care to like the best thyroid doctors in the country, but also improve the care for hypothyroidism by using a holistic approach and really thinking about how lifestyle, diet, plus, of course, the levothyroxine prescriptions can really help our patients, address the root cause of hypothyroidism and finally start feeling better, because a lot of patients still complain about those symptoms. And just to mention a few so that, maybe you guys can understand, it's like we're talking about weight gain, fatigue, depression, memory losses, foggy brain, hair loss, dry skin, because it affects every single organ in the body. It unfortunately has a huge impact on someone's life. And so that's why it's what we're doing at Paloma Health. I'm blessed for what we're doing every day and the reviews we're getting every day, because we're really helping patients with like something that unfortunately comes with a myriad of symptoms.
Yeah, and for the ones who are living with this condition, it is very obvious what they need to go through. But also for the ones who are not followed, there is a huge, as you said, a huge problem and a huge opportunity in the market to solve this problem and to make the life of these patients a little bit easier. Because if you are feeling symptoms a little bit more heavily in a certain period, it means that you need to do lab tests. It might mean that you need to change your medication, the doses, etc. And if you are able to do the majority of this online, you save a lot of time and you get better quicker, instead of just needing to book an appointment, going for your lab tests, blah, blah, blah. So it takes a lot of your time without feeling good. So I think that's great that Paloma is solving this huge need in the market, and looking forward when you guys come to Europe to test you out.
Yeah, it's like launching in a new state in the United States at this point.
Exactly. So at least you are already more than prepared for the next stage of growth. So, and if you would have the opportunity to have a coffee with yourself at the beginning of this journey with Paloma Health, what advice would you offer to your younger self?
Great question. I think the first one is, our mission was to, how can I say that? We were so focused on the consumer and the patient experience that sometimes you forget what investors want to see. And I think that's something like we've been able to change this pretty quickly. But we launched Paloma Health as a fully, a la carte offering where like people could pick, I want to book a doctor visit, I want to book a visit with a nutritionist, or I want to buy a test kit so I can monitor my hormone levels from home. And that was great because we're like, everybody has a different, experience. We're trying to offer like a personalized experience. So we don't want to put people into kind of like a one size fits all approach. And we're still not doing that. But all I'm saying is, over the month, and after discussing with a lot of investors, we realized, okay, the beauty of a membership, the beauty of understanding, what is like a good retention, how you're improving your retention, right, seeing the impact of your marketing initiatives on your retention. It's like you go beyond, NPS. And I think when people pay every month for a service, there's nothing more powerful than that. People in the healthcare industry are obsessed with NPS, and I'm not from the healthcare industry. I learned everything first as an investor and now as an entrepreneur. But like I'm realizing like retention is and engagement is king when it comes to like building a direct consumer business. And so really, when you have a membership, not only it gives you a better predictability of your revenue, it helps you create marketing initiatives that are going to like move the needle on the month-to-month basis for your retention. And so that was kind of like something we implemented recently, where like we thought about changing from an a la carte offering to more like a membership-based offering. And so we decided to kind of like follow the One Medical approach, where people have to pay a membership fee to join. It's kind of like a sign-up fee almost, where they get to meet their care manager, who's going to help them navigate the entire suite of services that we have to offer at Paloma Health. And this has been a huge success. So that's the first one. The second one is when we launched this membership, and this one is, I think, even more interesting. Because like when it comes to healthcare, it's interesting because I had to forget everything I've learned building SaaS product or building products for other companies and other industries. It's that people in healthcare, they don't want discounts. They don't want free trial. If you give them this type of offers, it's this type of coupons, they're going to feel like, oh, they're looking for like patients. They're not good. Nobody wants to see the doctor. But for us, it was coming from the place of like, we want to show the value of our product before we charge you for this product. Exactly. So that you can feel confident you're making the right choice, right? That's what we've seen in so many other companies and industries.
Great point.
But here it's the opposite. When we're doing A/B tests and we're like discounting, giving free trials, or giving your first month for $1, it was never working. The conversion rates were like getting bad. But one day we had the idea of like, let's do the opposite, and instead of like reducing and discounting everything, let's create an annual membership that is more expensive and let's make it the only option. And then suddenly our conversion rate went up and everything changed. And as you can imagine, for us as a business, that was the best decision ever, because we get, $192 upfront when people join. We get 12 months of guaranteed retention after that. And Absolutely. It helped us with growing the membership. And so this was a huge learning that, we need sometimes to go back to the basis of marketing rules, and those are, segmentation and positioning. And your pricing for something like healthcare is, extremely important to think about it and to A/B test, because sometimes you can be surprised by what you're going to see.
Exactly. This is a great point, because health is something very personal for the majority of us. And when we are not feeling very well, so we want to make sure that we are seeing the best possible doctor, and trust is all about. Exactly. So if the doctor is full and I need to wait almost 90 days, this one might be very, very good, right? If the doctor is available tomorrow, it might not be a very good doctor. It doesn't talk about the reality, but the perception is quite important, right? That's what we are talking about.
Exactly. It's surprising. And I'm trying to think if there is another advice that I would give to myself. I think those two are the big ones, really. On our side, it's just like, as we were changing the membership and realizing that suddenly people were like giving us so much money upfront, then we could accommodate higher acquisition costs. We lost maybe a few months really understanding that we can actually accommodate much higher CACs and therefore test new channels. So I don't think we'll make that mistake again. But it was interesting for us to stay like, sometimes you're focused on like, okay, my CAC is $50. And I don't want to pay more than that. And when you see an increase in CAC, you're like, you're scared. But actually, if your product has changed, you can accommodate, like 3-4 times this CAC and still have a good marketing equation. And so that took us not that much time, honestly, maybe 2 months to realize, but it's like, in the life of a startup, 2 months, it's a lot of time.
It's a lot.
You don't want to waste that time.
Definitely, that's a very good point, and especially for the ones who are scaling up bottom up and going from the mid-size segment into the enterprise segment. It's still a bit crazy for them increase so much the CAC when they've been optimizing the CAC for such a long time. as you said, we need to compare the CAC with the LTV, and definitely it's worth to increase the CAC if the LTV also increases more than the increase of the CAC. Right?
Exactly. But always, like for us, it was like the payback period was kind of like also on top of like the CAC LTV ratio. It was what the payback period on like your contribution margin looks like. And so that was like also very important for us to look at that. And that's harder because sometimes you have amazing retention over 5 years and your payback is actually pretty bad, but your CAC LTV is good. So it's sad, but you need to build a product for both patients and consumer and users and investors to make sure that those metrics are good, right? But the good thing is most of the time you need one North Star metric. You don't need 20. And so if that one works, it's good. It helps to scale.
Absolutely. That's a good point. We always discuss a lot in the show on the importance of radical focus in order to scale. In your case, in terms of the kind of the industry or the condition is quite focused. It's patients who are suffering from hypothyroidism. But even the brand also segments a little bit more. Could you share a little bit more how do you guys are segmenting and ensuring that you are being focused on attacking this opportunity as we discussed it before?
Yeah. So I think you said it, Mike, we're laser focused, right? We only treat hypothyroidism. Our doctors, they're endocrinologists, functional medicine doctors, they could definitely treat other conditions. But it's because we're so focused on hypothyroidism that, it helps acquire patients. And if you go down this rabbit hole, very quickly you realize, okay, women are 10 times more likely to suffer from hypothyroidism than men. Women are, underserved. Unfortunately, they suffered from a lack of research. And so we've built, with my co-founder, she has worked in this industry forever. We've built this women's health company thinking, we can definitely promote better engagement, promote better acquisition, better everything really, but it's really about the engagement. I think that's the key piece here by focusing specifically women, because it's 90+% of the market of hypothyroid patients first, but second is because by grouping them together, that's how we're going to build a better experience, because they're going to be more engaged, because we can build a patient community. And so that was kind of like our logic behind it is like, if the market we're going after, that 90+% of those people, they're like a specific demographic, you should address that demographic. And the truth is we do get some men to use Paloma Health. It's not that many for sure because of our branding, but the upside is the engagement we're seeing between, all the other women that we're helping. And I think it's worth it. I think it's worth it to kind of like, for now, maybe not get those 10% and focus on the 90%, but make the experience and the engagement better for those 90%.
Love it. And it's really important to not be afraid of doubling down on that core customer and having this kind of fear of missing something out, right? That's really difficult to do.
But on our side, there was a kind of like a trap that we've identified pretty quickly, which was the test kit can be used for diagnosis. So even if we're laser focused on hypothyroidism, at one point we realized, okay, we're acquiring sometimes patients who don't have hypothyroidism and they're looking for a diagnosis. And that's great too, because on our side, we want to, raise awareness for this condition. We want to help patients get a diagnosis for sure. And, our test kits are, legally and in any way, capable of doing that. It's just like they're not the same type of, LTV, it's very different, right? When someone buy a test kit and then you never see them again. And on the other side, we have patients who are going to stay with us for maybe the next 5 or 10 years because we're the new thyroid doctor. And so that's something to take in mind. And it took us maybe, again, a few months to realize that and then to adjust, because Facebook algorithm, when you're doing ads on Facebook, they can very, very quickly, if you're doing your work of like A/B testing every creative, every copy, every week, right, or every month, then very quickly you can be kind of like directed by Facebook in one specific direction. And that direction is going to tell you, like, you need to acquire people like that because they have the cheapest CAC, because the ROI on one single transaction is good, right? That's the issue of like Facebook optimizing for like a return on ad spend versus optimizing for like a high LTV patient. And so our laser focus kind of like had some, traps that we had to navigate and understand and identify. So sometimes you still need to be aware of like what can happen within your demographic.
Because that is one of the issues in the industry and why the TAM is also always expanding. So it is expected that more and more people will be suffering from hypothyroidism in the future. And today, almost 50% of patients are not diagnosed yet. So they are suffering weird symptoms, but for any reason, the doctors, whatever it is, they have not been diagnosed yet with the condition. So they are not treating it yet.
Definitely.
And so you were saying that you are focused on the ones who have already figured out or are diagnosed that they have this condition, and to make the experience of living with this condition a little bit easier and better, right?
Exactly, because they understand the pain points. Right now, as a hypothyroid patient in the United States, it takes on average, around 40 days to get an appointment with a doctor. You were talking about those pain points, Mike, earlier, about like the back and forth between the labs, the doctor offices, the fact that the current standard of care doesn't even take, lifestyle intervention as, something that can help hypothyroid patients. It's, all those pain points are really making this experience pretty bad. And so someone who had hypothyroidism for 10 years understand these pain points very well. And when they come to Paloma and they see, okay, those doctors, they only treat hypothyroidism. They only treat the chronic condition that I have that is impacting my work life, my personal life. This message is extremely powerful. When someone is using a test kit from Paloma Health, whatever we say, telemedicine, home test kits, there is still a bit of mistrust. COVID-19 helped a lot with adoption. We're still seeing, an adoption rate of telemedicine of like, I think in the United States last year, I was reading a report, it was like 5% or 4%, I think. So it's like out of all the consultations that happen in the United States, only 4% were done through telemedicine in the United States last year. So there is still like a trust component that we need to like completely solve for. It's not done yet, but that also show the penetration, right? The potential of penetration for the future of like where we can go with telemedicine. And it's very exciting.
And that's a very good point, because there are a lot of endocrinologists who are not trained very well to treat this kind of condition, and ensuring that there is a platform that is already trained by what needs to be done in order to help the patient to get better as quickly as possible in a smooth with a smooth process instead of a frustration based process makes a huge difference. And then when there are doctors who know what they are talking about, they are focusing on different autoimmune diseases and not in just one, right?
Yeah, and that's a key for us on the retention side, is matching patients with the right doctor. You mentioned endocrinologists. Honestly, most endocrinologists are like properly trained on hypothyroidism and doing an amazing job. It's just maybe sometimes not what the patient is expecting. I think it's just a matter of like expectations, like how those expectations, fulfilled by a specific doctor. And so on our side, what we started to do very early on is like, how can we match the patients with the right doctors, depending on their health goals, depending on, gender. Some patients, they want to see, a female doctor, some other want to see a male doctor. So it really depends. But like, if you do this matching right, then, you're going to improve this experience and everything. Because to go back to trust, if the patient doesn't trust the doctor, the treatment, the care plan, everything else is going to be tougher. And so if you get this, an alchemy between the patient and the doctor, then it's going to be a success. And on our side, we even started to do like a satisfaction guarantee, where like their second consultation with another doctor is on us. So if their first consultation with a doctor didn't go well, they're like not that happy with that doctor in the end. We're like, okay, the second doctor is on us. You pick another doctor from your state, and because it's so key to make sure that we can help patients find this, the provider that is going to change their lives, and so we want to make sure we're doing it right.
Absolutely. Great job. So we have discussed the huge opportunity or the size of the problem that we have, that it's an expanding market. The TAM keeps increasing. The importance of having a clear segment or ICP in order to scale. Also, you have shared another lessons learned with the CAC, the LTV, to not do discounts, the importance of moving into a subscription model in terms of retention and repeatability. But it's also very important to have the right team. So you have exited 2 companies and have been working in a fund before. So what have been some of the lessons of getting back into a very small founding team and then starting to have the first team members and now starting to prepare to go to another stage of scaling up?
Yeah, great question. So first, during the past 2 years, I think we got extremely lucky to be working with friends and people who are like so amazing, and that's because I think and they're all extremely great and everything. I'm just saying, you need doers in the beginning. You need people who are going to do things, who want to get their hands dirty, and that's how they feel fulfilled by their job. And that's really what we try to identify. It's tough when you're meeting so many candidates. How do you know if someone is actually going to be a doer? And of course, don't hesitate to do assessments, to ask them for homework. Of course, you cannot do that with the 50 or hundreds of applications that you're going to receive, but the last 4 or 5, that you really like, go for it, because that's really how you're going to see are they overachievers, and that's going to really help. Because in the beginning, don't look for fancy MBAs. I mean, if you can find someone who's a doer and had a great MBA, that's even better. What I'm saying is it's more important to find people who want to do stuff, want to get their hands dirty. On our side, our main value is about learning. None of us worked in a medical practice before, and we've all learned everything by just doing it. And I think that's also the other most fulfilling part of the job is how do you grow as a person? And personally, and I don't know if it's the case for everybody in the team, but personally, I feel like I'm growing by learning. And so I try to promote that also in the team. And honestly, it's so amazing to see, what we've accomplished with such a small team over the past 2 years, and how we've learned so much. But you said it at one time, it's also time for scale and growth. And so you need to give people responsibilities, and that's also another time where usually people embrace it, especially if they've been with you for from the beginning, right? Where they can take on new responsibilities, start managing people. Because the truth is, during the first year or 2 years of a startup, depending on how fast it goes, it's everybody's working together, right? But they're not managing anyone. And so it's just the natural next step is for someone to want to manage and get into more a leadership role. And so that's the phase we're gonna start very soon with Paloma Health, and I can't wait to see this new phase. And we've had amazing employee retention at Paloma Health, and so I can't wait to see these people we've been working with for the past 2 years embracing these new responsibilities and these new roles.
Well done. And it comes one of the most important moments of going from a founding team into a leadership team 1.0 and start filling those first VP or head of roles. And as you said, it would be great to be a combination of people being promoted that are able to scale with the company. And of course, usually we also need some people coming from outside to bring some experience to the mix to help the company scale. And usually that's that's this combination that works the best. Not only just external
100%
people or just internal ones that will miss maybe bits of context, outside context, right?
Yeah, totally agree with you. And I mean, we've identified a few positions that we need to fill. And right now we're all getting our hands dirty, doing 2 or 3 jobs at the same time. And so, it's at one point, everyone needs to focus on something more specific and at the same time so that we can hire other people, other leaders in the team as well.
And that is a good point. Also, having a prioritization of the roles that we need, not trying to hire all the roles at the same time and onboard all of them at the same time. Usually that's a nightmare. It's better to go one by one, or at least 2 by 2, let's say.
Definitely. I think we've heard it from so many people, but hiring people in groups and training them together, it creates this unique sense of like camaraderie and friendship, and it really helps with like onboarding. So that's definitely something that we didn't have the chance to do at Paloma Health, but I've heard from like so many companies, and now they're only trying to do that. They're like, okay, let's try to hire this person maybe 2 months earlier than the actual needs, but so that she can start or he can start at the same time than this other candidate, and that makes sense.
And there is something that I also like to cover in the last minutes of our conversation here today, which is something that you did very well and that we are seeing a trend, but it's still very difficult to do, which is being able to automate a lot of your processes and having a relatively low head count compared to the output that you are able to produce. So which will be very helpful to scale the company a little bit later.
Yeah. So I'm a big fan of like the no code revolution, from like Webflow to Airtable to Zapier, and how you can create amazing automations connecting everything. In this case, for Paloma Health, it was pretty tough because of HIPAA. HIPAA is those healthcare regulations where we need to protect, what is called PHI, personal health identification information. And in this case, so we had to make sure, everything we're doing, all these tools, we're not getting any type of like PHI or PII, and that we could automate stuff. And so I think we've done it successfully, so that, everything is automated on our side. So like most people, we have a web app and a mobile app, but our marketing website is on Webflow. So Webflow is this amazing no-code, website builder, if I can call it like that, where you can really iterate quickly on your landing pages. So for example, for us, we've created thousands of landing pages using their CMS that we could connect to like AdWords on the other side. We did a bunch of things like that with Webflow, but really where I think we've automated a lot of things is within Airtable for every like order on the supplement side, to track inventory and inventory counts, to track, to send automatically all the orders to our 3PL partner, because we have a 3PL partner now. So it's like automating all this. And also I think where it's pretty amazing, and people always need to think about like alerts. How do you get alerts set up when there's an exception? I think on our side, we've like optimized everything, and we've like one shared mailbox for the entire team, optimized the alerts and notification when something goes wrong. And therefore, as we were saying, you can keep the headcounts pretty low for what we're doing. That extends beyond those no-code software. On our side, as you can imagine, our care navigators, the people who are helping the patients every single day, they have a lot of automated tasks. And so we're like, how can we connect the data from our doctors, our clinicians, our providers with our customer support software, right? And so that's where we've been able to kind of like connect both together. We call it programmatic outreach. It's like, how can we initiate outreach from care navigators based on, I think we have like 25 different fields that can automate an interaction between the patient and their care navigators. And everything is automated, but it's really personalized. The experience is 100% personalized because it depends on like what we got from them through the product, through previous visits, where we, and all this is fully HIPAA compliant as well. with encryption all along. So it took us a bit of time to build it, to be honest. But right now it's like, we can have one care manager taking care of like thousands of patients at the same time, because all this is automated, and then we have saved replies and everything to really get back to the patient very quickly. So I think and the truth is you cannot do it at the very beginning of your entrepreneurial journey, because you don't know exactly what it's going to be like. So you need to wait a few weeks and months before you can actually automate all that. And that's what we've done. And really it's a game changer for us, because you can then embrace the growth and the scale because you've automated so much. So yeah, I would recommend it to anyone to really think about automation sooner than later, so that you can embrace the growth.
And resist the temptation of just sending people to problems and expect that magically all the problems will get sorted out, because usually it gets worse, and then you have alignment issues and execution issues, and you might need to downsize before scaling up again. So that's a good lesson to learn. That's why I was curious to learn more about how you guys the patience of putting the system in place before scaling up. Because of course, all the founders, again, the purpose is amazing, the mission is incredible, and we want to serve as many people as possible, and we want to scale up faster. But sometimes scaling up faster in the beginning will make us scale up slower, or even need to downsize before scaling up again later. And lose more years in the future than now.
You can definitely break things. It's not related to automation, but in the same vein, a big national retailer came to us to think about, like, can we sell your kits in thousands of stores across the country? And at that point, I mean, we're not ready for that, and I think it would break too many things. And so we said no. And some people were like, "You're completely crazy." But at the end of the day, I think it was like the best decision, so that we could keep building, keep getting amazing retention, NPS, because if you break things, if your reputation is not good, especially in healthcare, then you lose everything you've built. Again, it's like to go back to trust, but that trust component is everything. And if you lose that trust, then your brand is getting badly hurt, and everything else falls apart. So yeah, sometimes you have to make a tough decision like that, of like, declining a huge opportunity, but it's for the best.
Exactly. And before we go, I promise it's the last question, but I can't resist the temptation of asking this. Of course, you are starting up in the US, and it makes all sense to scale up in the US. You have also been starting up companies from a French perspective or European perspective, where in the majority of the cases, the plan is the same. How can we go as quickly as possible to the US to scale up in one language? So we know all the reasons. I will not repeat them here. But what about the opposite? So you are able to create a very big company to solve this problem just with the US itself. As you said, you already have enough complexity with so many states in this case. So no need to think about the rest of the world, to think about Europe, APAC, Latam, Africa, etc. Was this the reason, because the opportunity is big and because you are based at this stage in the US, to start up there and to scale up there, or do you have any other insights in mind?
Yeah, that's a great question. I think we're building the moat, and I think it's easier to build the moat when you're like geographically focused, right? And we've seen it with so many other companies, like how many Uber-like businesses were started like in specific cities and states, like Austin, or even in France. I've seen some companies doing that and then being acquired by Uber because they knew they could own an entire geography and kind of build a moat. And so, in this case, we're definitely not trying to be acquired by Uber. I'm just saying this, like, for us, is like, how do we can like own, hypothyroidism in the United States as a direct consumer and a B2B company, working with employers, working with the payers, working with the health systems and the primary care networks. And so there's just so much we need to do still in the United States to feel like we've built a moat, and it's not the case yet. So, that defensibility, I think it's easier to build it when you're geographically focused. That being said, I'm definitely French. I saw today, I think in the news, there was like this French startup focused on cancer that just announced a $40 million Series A. So exciting to see that. And so definitely, I think things are moving on the healthcare side in France. The truth is, from what I'm seeing in the United States, there's just so much innovation here. Everyone is thinking differently, right? We're thinking because of the health insurance companies, because, I think the healthcare is especially broken in the United States, and the cost of healthcare is especially high in the United States. That creates so much room for innovation. Right. And, it feels good, what we're doing on the employer side, for example. Livongo and some other companies focus on diabetes or MSK or some other specific conditions have done it, and they've paved the way on like how to go after employers, how to improve ROI for the employers. And so in this case, we're very happy to be as kind of like a virtual specialty clinics, very happy to be following the footsteps, or like creating some new footsteps also with some new type of partners in a very innovative ecosystem. I'm not saying Europe is not, I'm just saying here, there is even more room because of that potential for ROI when you work on the B2B side because of the cost of healthcare. Does that make sense?
And the size of the market is so big that I think that in a certain stage it's to keep dreaming for global domination, but at the same time, understanding that in order to unlock that vision, just the vision of being able to scale up and solve this huge problem in the US and to be a leader in the solution of this problem in the market is so big that when we get closer to that, we start thinking about the world, right? So at a certain point, let's focus on execution and making it happen in the US first.
Definitely. I mean, it's 25 million people who suffer from hypothyroidism in the United States. It's almost half of the French population or the Spanish population, right? So it's like, it's different.
It's another scale.
It's
amazing. G, thank you so much for joining us. And of course, all the best for Paloma. And you are always welcome to share your progress with us in the future.
Awesome. Thank you so much, Mike, for your time and for your amazing question. And we'll talk soon then.
Absolutely. And to you, we keep bringing you the best of the best to make it a little bit easier scaling up your company. This is a special edition where we cover also the healthcare way of scaling up. And today was G, the co-founder and CEO at Paloma Health. See you soon and keep scaling.